Have you noticed that sitting up straight has become a challenge? That back pain shows up before you even get out of bed. Your shoulders roll forward without you realizing it. And staying upright feels like it takes energy you just don't have anymore. It's not fatigue. It's your body sending you a silent warning. After 50, the deep muscles that support your spine start to fall asleep. Gravity wins daily battles. And what used to be automatic now requires conscious effort. But here's the truth. It's not age that curves your back. It's the absence of movement. Your body forgets what it doesn't practice, but it can also relearn. Today, you're going to discover 5 simple, safe, scientifically backed movements to reprogram your posture. No equipment, no gym, no pain. Practices that restore your spine's elasticity, reactivate your balance, and wake up dormant muscles. Imagine walking with your head held high, breathing deeply without strain, and looking forward with confidence. This isn't an empty promise. It's the result of consistency, and it starts now. Before we continue, tell me in the comments where you're watching from and your age. I love knowing how far this community of determined people is reaching. Stay with me, because your transformation begins in the next few minutes. The problem explained over time. The discs between your vertebrae lose water. Your joints stop producing the fluid that lubricates them, and tissues stiffen. The result: a less flexible spine that responds slowly and complains easily. But research in geriatric physical therapy shows this process can be reversed with gentle, controlled movements. The problem isn't aging. It's stopping movement. Every day on the couch, every afternoon hunched over your phone, accelerates this stiffening. And it doesn't just affect your posture. It impacts your balance, digestion, even your mood. The good news? You can interrupt this cycle right now. Let's go straight to the first movement that will wake up your spine. Movement number 1. Controlled heel raises. Let's start with one of the simplest yet most powerful movements to reactivate circulation, strengthen legs, and restore stability. Many physical therapists call this practice the heart's forgotten pump, because your calf muscles work as a mechanical pump, pushing blood back to your heart. When they weaken, blood pools in your legs, creating heaviness, swelling, and fatigue. How to do it? Stand near a chair or wall for support. Keep your feet hip-width apart and your core lightly engaged. Take a deep breath. And as you exhale, slowly lift your heels until you're on your toes. Hold for 5 seconds, feeling the tension in your calves. Lower with control until your heels fully touch the floor. Repeat 10 to 15 times for 3 sets. If your body allows. If you prefer sitting, that works too. Keep your feet firmly planted and lift only your heels, keeping your toes fixed. The secret is in the slowness and consistency, not the intensity. Medical benefits. This movement improves venous return, reduces swelling, and prevents varicose veins. It strengthens ankles and feet, improves balance, and stimulates proprioception, that ability to stay upright without looking at the ground. Recent data indicates that just 2 minutes daily can increase venous return efficiency by up to 30% in sedentary people. If you have hypertension or venous insufficiency, consult your doctor first. Feel the blood circulating, your legs awakening. Now get ready to release the body's most forgotten region, your hips. Movement number 2. Seated butterfly. Hip stiffness is one of the biggest enemies of balance and posture after 50. Over the years, the muscles on the inside of your thighs tend to shorten, limiting movement and putting pressure on your lower back. This makes walking or squatting difficult and misaligns your entire body, curving your spine. The butterfly movement is simple and deeply effective at releasing accumulated tension, recovering pelvic mobility, and improving stability. How to do it? Sit on the floor or on a firm surface. Bring the soles of your feet together in front of you and hold your ankles. Let your knees drop gently to the sides without forcing. If you feel difficulty, place cushions under your knees. Breathe deeply, and with each exhale, allow your legs to relax more. The movement should be natural, rhythmic, like butterfly wings opening slowly. Stay in this position for 1 to 2 minutes, making gentle bounces if you want. If you want to intensify it, lean slightly forward, always keeping your spine straight. This activates your adductor muscles, opens your pelvis, and reduces tension in your lower back. Medical benefits. The stretch improves venous circulation, promotes hip joint mobility, and prevents falls by increasing stride length. Research shows that those who practice 3 times a week reduce their risk of balance-related falls by 40%. By releasing the pelvis, you also improve intestinal and respiratory function, allowing freer movement of your diaphragm. This movement doesn't just relax your body, it calms your mind. By coordinating movement and breathing, you activate the parasympathetic system, generating peace and internal balance. If you feel looser hips and smoother breathing, smile. You're taking back control of your center. Movement number 3. Adapted cat-cow. This movement is as simple as it is powerful. Inspired by Eastern body therapy and adapted for people over 50, it mobilizes your entire spine, from neck to lower back, reactivating the deep muscles that support your posture. You don't need strength, just attention and breath. How to do it? Position yourself on a comfortable surface, mat, firm bed, or stable table if you prefer standing. Place hands under shoulders and knees under hips. Inhale deeply as you gently arch your back, lifting your chest and directing your gaze forward. This is cow pose. Feel the air expanding your chest and creating space between vertebrae as you slowly exhale through your mouth. Round your back like a cat stretching after waking. Let your chin move toward your chest and relax your abdomen. Repeat this cycle 8 to 10 times, without rushing, following the rhythm of your breathing. It's not about going further. It's about doing it mindfully. With each repetition, you'll notice your spine warming, morning stiffness disappearing, and your body remembering its natural mobility. Scientific benefits. This movement stimulates the production of synovial fluid in spinal joints, improves muscle oxygenation, and activates the vagus nerve, responsible for relaxation and blood pressure control. It helps reduce mild lower back pain and improves coordination between breathing and movement. Research shows that regular practice can increase spinal flexibility by up to 25% in just 4 weeks. Finish by sitting on your heels, or if standing, let your arms fall freely. Breathe deeply and notice the lightness in your back. Movement number 4. Adapted child's pose. Child's pose is one of the most restorative movements for your lower back and hips. It's not just a physical stretch, it's a gesture of deep rest that relieves accumulated tension and reconnects breathing with your body. It's perfect for those who spend hours sitting, feel lower back pain upon waking, or notice their back has lost flexibility. How to do it? Find a comfortable surface, mat or bed. Kneel with feet together and knees apart, hip width if you feel discomfort. Place a blanket under your ankles or a pillow between your thighs and abdomen. Lean forward slowly until your forehead touches the floor or a pillow. Let your arms extend forward or rest alongside your body once in the posture. Breathe deeply with each exhale. Feel your back expanding and relaxing. Hold the position for 30 seconds to 1 minute, or longer if comfortable. The goal isn't to force anything. It's to surrender to your body's weight and let gravity do the work. Medical benefits. This posture creates passive stretching of the paraspinal muscles, glutes, and hip capsule. It relieves lumbar compression, reduces pressure on intervertebral discs, and improves circulation in the pelvic region. By releasing the abdomen and favoring diaphragm expansion, it improves oxygenation and reduces nervous tension. It has a direct effect on the parasympathetic nervous system, the one that activates calm and rest, decreasing heart rate and cortisol levels. Clinical data shows that 3 minutes in this posture can reduce heart rate by up to 10 beats per minute. That's why it's ideal both for finishing your sequence and for practicing before sleep. Stay a few moments in silence, feeling your back relieved and your breathing flowing effortlessly. Movement number 5. Gentle supine twist. This final movement is the most complete and therapeutic for returning mobility and youth to your spine. It not only relaxes the lower back but also improves circulation, stimulates internal organs, and deeply calms the nervous system. What makes this movement unique is its triple effect. It decompresses spinal discs, releases accumulated tension, and at the same time, massages abdominal organs, improving digestion and toxin elimination. How to do it? Lie on your back on a comfortable surface with legs extended. Bend your right knee and bring it gently toward your chest. Holding with both hands, inhale deeply, and as you exhale, let that leg fall to the left side, Crossing over your body, extend your right arm to the opposite side and gently turn your head in that same direction. Don't force the movement. Let the weight of your leg and your breath do the work. Keep your shoulders in contact with the floor and feel the twist. Distributing from waist to neck, stay in this position for 30 seconds to 1 minute. Breathing slowly and deeply, then return to center and repeat with the opposite leg. You can place a pillow under your knee if you feel tension. Physiological benefits. This controlled rotation decompresses intervertebral discs, improves spinal hydration, and releases tension along the entire posterior chain. By stimulating the vagus nerve, it helps balance the autonomic nervous system, reducing stress and improving digestion. Research indicates this type of rotation can increase synovial fluid production by up to 40% in just 2 weeks of regular practice, which equals rejuvenating your joints by several years. Many therapists also recommend it for relieving mild sciatic pain and preventing muscle contractures. Each deep breath works as an internal massage, promoting tissue oxygenation and muscle relaxation. When you finish, stay a few seconds with eyes closed, noticing the lightness in your back and calm flowing through your body. You've completed your sequence. Your spine is freer, your mind calmer, and your body rejuvenated. Safety guidelines. Before incorporating any routine into your day, remember, prevention and listening to your body are the foundation of safe practice. These movements were designed for mature adults, but each person has their own rhythm, health history, and mobility level. The secret is progressing without pain, without forcing, and with full awareness. Important tips. Start by dedicating just 10 minutes per day and increase gradually as comfortable. If at any point you feel sharp pain, dizziness, or shortness of breath, stop and rest. Your body should feel worked, never punished. Always keep your breathing fluid. Avoid holding your breath, as this raises internal pressure and can affect your heart or head. Use stable surfaces, comfortable clothing, and if needed, support yourself on a wall or chair. For those with hypertension, advanced arthritis, hip prosthesis, or cardiovascular issues, consult your doctor or physical therapist first. Hydration is also essential. Drinking enough water before and after helps keep muscles and joints elastic and reduces the risk of cramps. If you've gone a year without moving, don't expect immediate results. Your body has memory, and with patience and consistency, it will respond. And above all, don't forget, age isn't the cause of pain. Lack of movement is. Today you did more than move your body. You awakened the strength that was still sleeping inside you. With each breath and stretch, you remembered that you still have power over your posture, energy, and well-being. Standing upright isn't a matter of appearance. It's a declaration of life. It means looking forward with dignity, confidence, and the pride of someone who doesn't surrender to time. These 5 movements are just the beginning. Practice daily. They'll return flexibility to your spine, lightness to your steps, and serenity to your mind. You don't need a gym, just the desire to take care of yourself. And if you took the first step today, you're already on the right path. Imagine how you'll feel in a few weeks. Breathing without pain, walking upright, feeling stronger, more alive. That future depends on you and what you'll do with the next 10 minutes of your day. Tell me in the comments which of these movements brought you the most relief. And if this content helped you, subscribe to the channel to keep receiving science-based health guidance. Because every day is a new chance to prove that aging doesn't curve you. It teaches you to stand up.